Good morning, and welcome to the Research for Action, Exploring the Gaps, a program sponsored by the Grandmothers Against Gun Violence Foundation. I'm Cindy Jackson, co-chair of the foundation, and we'll be getting it started today. Since 2018, the foundation has raised funds to support research that informs public health and prevention policy. That safety policy and that public health work is necessary to improve our understanding of the causes and prevention of gun violence. Thus, the work of researchers is essential. Today's program is an opportunity for 3 researchers recently funded by the Grandmothers Against Gun Violence Foundation to share their research and how it informs our practices and understanding of the gun violence and prevention issues. After each presentation, there'll be an opportunity for you to go a little deeper with some questions through the chat so that we will be able to have a thorough understanding of the work of our researchers. Today's panel will be moderated by Dr. Ali Rohani Rabar. Dr. Rohani Rabar is the interim director of the Firearm Injury and Policy Research Program at the University of Washington, and a professor of epidemiology, an adjunct professor in School of Medicine and Evans School of Public Policy. So with this background and connection, we introduce Dr. Rohani Rabar to introduce our participants.
Great, thank you so much for organizing this event. It really is incredible to be here with you all. Special thanks to Grandmothers for organizing this event, bringing all of us together. I'm going to start just with a few comments and remarks about our experiences and what we have achieved and the tremendous work that Grandmothers have done, and then I'll introduce the 3 speakers one at a time. Grandmothers began, as many of you probably know, began funding research on firearm violence and injury several years ago when there really wasn't much funding for this area of work anywhere in Washington state or, nationally. The courage and commitment that the Grandmothers have demonstrated in this space has been an inspiration to many of us and many of people around the country. As you mentioned, I'm now a professor, but several years ago when I was a junior faculty member, I was an assistant professor. Our team received one of the first awards from research awards from Grandmothers, and that award led to several important publications in high-impact journals such as Annals of Internal Medicine, American Journal of Public Health, JAMA Pediatrics, Injury Epidemiology. And that body of research also informed practice and policy for firearm injury prevention. Since then, as some of you know, the landscape for funding for firearm injury research has changed. Beginning in 2020, the federal government, particularly the NIH and CDC, and some foundations really have devoted specific funding to gun violence research. So this is incredibly most welcome and promising, especially since we increasingly need to generate evidence to inform practice and policy to save lives. But as I always say, there is a critical need for new and continued funding. Firearm injury remains one of the leading causes of death among children, adolescents, and young adults in the United States, and deeply affects many, many communities, especially communities of color. So the total funds available at the national level for research in this area is extremely small, proportionally compared to the substantial burden of this public health and public safety problem. We need sustained and robust funding to make a difference, to move the needle and save lives. Most notably, there is a critical need to support the next generation of researchers so they can sustain the momentum that we have just gained after many, many years. And we are grateful to Grandmothers for their insight and wisdom and identifying this need, this gap that has led to the creation of funding opportunities for junior scholars, rising stars, and leaders of the future, our trainees. And so today I'm delighted to introduce 3 such trainees who have received awards from Grandmothers for their research. The three research projects that they're going to introduce today and produce and present promise to exemplify what's really called in the field as consequential research, the research of consequence, the type of research that is not just confined to the ivory tower and walls of academia. It's a research of consequence. It will inform programs, policies, practices that could truly save lives and prevent injuries and improve well-being and health of our communities. So with that, I'm going to introduce our first speaker. Lars Almquist is a PhD candidate in the Department of Health Systems and Population Health at the University of Washington School of Public Health. He's passionate about leveraging the unique and largely overlooked strength of healthcare institutions to break cycles of violence and retaliation, and using qualitative research methods to capture the complex realities surrounding a person's repeated exposure to violence. Today, Lars will be presenting on his research to investigate the implementation of HVIPs, hospital-based violence intervention programs, across the US. Each of our presenters will present for 10 minutes, and then we'll open up for Q&A for 5 minutes. Lars, I think you can share your screen.
Thank you, Ali, and thank you, grandmothers and those who are attending. Great, thank you. Thanks for having me. Thank you so much for funding this work. We'll get into a bit about what you'll be funding in particular. I'm super grateful to be here, and thank you as well for having me. And so, yeah, we're investigating the implementation of hospital-based violence intervention programs targeting community-level firearm violence. With the slight disclaimer, that in talking about community-level firearm violence, I'm not going to be talking about suicide, intimate partner violence, school shootings, and things. That there's a level or an engagement, it's different when it comes to certain types of community violence. That I'm just not an expert in those other topics that some of my colleagues will actually be talking about today. And so my posture when I come in, I have no financial conflicts of interest to disclose. I recognize that I come in with a set of biases, particularly as a white, well-educated man working in a space that disproportionately impacts younger men of color. And I also come with a bias that violence is tragic but not random. That there are no senseless acts, or there's senseless, but the violence is not random in terms of what we study, and we'll talk about that in a bit in terms of the network nature of violence and how that actually impacts how we approach it, and that I just don't believe that anyone kind of wakes up, decides to take a great walk along the sound, thinks about it for a bit and decides to commit a murder. I just don't think that is how folks operate. That there's actually very systemic and structural factors at play that impact how these how violence plays out. And so for our roadmap for today, we're going to be talking about community level firearm violence. The intervention I'm interested in is hospital-based violence intervention programs, or you'll hear me say HVIPs. We're talking about the gaps, answering the how questions, kind of looking upstream as to how we are doing this. How are these coming to be versus are they effective? What's the results? And some of the implications. So what? Why does this matter? Why approaching it from the way I'm going to approach it? Then we'll have some time for questions. And so in setting the stage, I want to engage in a bit of reframing of violence. And this may be not reframing for you, but reframing for a lot of the folks who I speak with, that when we look at crime and violence are simply lenses through which we view social disorder. Right, they're lenses, they're things we put on, we look through, and the lens we choose determines the prevention focus and what treatment mechanisms are available to us. And this is very public health language. I think public health has abdicated kind of engaging violence, like Ali said, until very recently, both in terms of funding, in terms of attention. And so when we look at things, when this comes from on the left is from the Seattle Police Department, on the right is from the Seattle Times. We tend to look at violence and community violence as, a neighborhood, as geography, right? We break it down by neighborhood, by zip code. We're not immune to this in our spatial reporting from our research and our publications, but we look at territory, right? And we talk about, there's this language that creeps in of bad neighborhoods or sketchy neighborhoods or a place you wouldn't walk at night. Just you hear, the dog whistle, Chicago or Pioneer Square and things. And when we start looking at that and we have a lens that, kind of focuses in on geography, it shapes how we approach this, right? And so we engage in policing mechanisms that police kind of territory, and you get, kind of pretextual stops and stop and frisk policies and things that kind of looking for things that might go wrong. When in fact, what we're actually learning about violence is that it doesn't operate kind of, territorially like an airborne contagion. It actually operates more like a bloodborne contagion, akin to how HIV, hepatitis, et cetera, spread. It's a big, kind of a turn in our knowledge and our understanding of the last few years, is that violence actually transmits person to person. It's not somewhere you go and you catch it, right? The people who live in those areas, the vast majority of them do not engage in violence, right? It's a very small number who do. And so like judging this by an entire territory, is misguided. And so we can see here that, this is some examples from the work of Andrew Papachristos that you can have basically what are called cascades of violence, where someone is injured, or shot, and then through retaliation, or, getting back, or kind of this tit for tat that goes on, additional people are shot. And the folks who are with you in your social network, if they are with you when you are shot or you are engaged in this, they're now exposed to violence. And you start building this network of people who are exposed to violence, where one instance of retaliation or one shooting can actually, reverberate through an entire network. And so these are three examples. For example, one instance in part C there, one person getting shot reverberated through 64 different people getting shot in degrees of separation where they're actually still connected to one another. The violence is actually very highly networked. And so, this is just an example of a particular network that, can transfer from one person to one person to one person and expand throughout, a wider, group of people. And so basically disproportionate levels of violence, they concentrate in dense, what I call like micro networks, like really small networks representing a fraction of a total population. A great example is Boston, and for the last 30 years, from 1980 to 2008, had one of the highest murder rates in the country, and during that time, less than 1% of the youth ages 15 to 24 were responsible for half of all the murders and 75% of all firearm assaults in the entire city at the peak of that city's violence in the history of that city. Let me say that again, right? So so you have Boston, and then you have the age cohort of 15 to 24-year-olds, and then take that and you have 1% of that. 1% of that group was responsible for half the murders and 75% of all the firearm assaults. A dramatically small proportion that are very densely connected together in a very dangerous set of networks, right? But the dominant lens remains, and this is how we focus on it, and that's how we see it. It's easy to digest. And so you get these headlines, right? You get these, it's the air we breathe when we consume the media, consume certain articles, even in our academic work sometimes is, these violent neighborhoods, right? Rather than individuals in violent networks that happen to occupy certain places and neighborhoods. And so what is to be done, right? One of my favorite quotes from Thoreau is for every 1,000 hacking at the leaves of evil, there's one striking at the root. I'm not under the delusion that my work right here is exactly striking at the particular root. But part of what I'm trying to do, and part of what we're trying to do is to get there, right? Is to actually, get past, some of the media representations, et cetera. Like what's actually the root of what we're doing here? And that's what you're funding. And so what is a hospital-based violence intervention program? Essentially, basically what it is when someone comes in to the ER or the trauma center with a violent injury, you essentially have someone meet them at the bedside, working to disarm and disengage desires for retaliation. So if you imagine a social worker, a case manager, a patient navigator, slam those into one person, one employee, have that employee have a lived experience of violence themselves, ideally in that community. And you basically place them next to the ER so that when someone comes in and is admitted to the hospital for a violent injury or a gunshot wound, they're there at the very beginning. And what's called the teachable moment, this moment where, folks, especially young folks, are disproportionately likely to be open to changing behaviors, decisions, et cetera, that got them exposed to violence in the first place. And then that person will basically invite that injured patient to walk alongside them for 6 months, 12 months, 2 years, to help rebuild their life outside of violence by engaging social determinants of health that help them kind of stay out of those networks, and also modifiable risk factors, things that they can actually change that may have put them at an increased likelihood of being exposed to violence in the first place or re-exposed. I can pass this a bit. Age trips, there's a rapid expansion of age trips. There's only there's like roughly 60 of them. Half of them have come online in the last 9 years. As Ali said, there's actually more funding coming down the pike to them. But one of the things we're wrestling with is that we don't have a clear grasp of the effectiveness of them across institutions, that because of how they were implemented at different times, at different, with different methods, et cetera, we have a lot of these kind of deep evaluations of individual sites. We don't have cross-site work when it comes to these outcomes. And so we have mixed results. We have small sample sizes. We don't have the ability to transfer a lot across, to transfer, to kind of generalize, what does this work do? How should we do it? And so one of the things that I'm interested in is the gaps that have come here, right? And so looking upstream through the lens of implementation science, kind of the science of how we do things and how we get there. So I'm not actually looking at finding the outcomes. I'm looking at how we create the system that then we can go and look to get outcomes through. So further upstream. And the goal with that is to close the gap between what we know and what we do. So we're doing a lot, but we don't necessarily know, all the ways that, XYZ could be better, hindered, moved, helped. And so trying to identify the barriers from, upstream to how we can help this new wave of programs coming online. And so a couple of the gaps, we don't have almost any information on, from an implementation science lens regarding HFIPs. We have almost no information, no scientific information on factors that help or hinder the early implementation, the startup of these programs. The experts estimate they take 2 years to start up, and that's a long time. We have no scientific knowledge of what goes on in that space that helps or hinders that process. We also have no knowledge of the recruitment, retention, and recovery strategies that those violence intervention specialists who are stationed at the ER, what they use. Right, there's almost no information out there, in the academic world, in the research world, about what those folks do in a very difficult job to navigate, a broken bureaucracy, folks with PTSD, a very violent context that they're working on in the community. And we also don't really know what it takes to sustain these programs long term. So folks are kind of operating and going through these motions that they know, but we don't know how to engage that over time. And so what you're funding is essentially, what I'm looking at is engaging the barriers and facilitators, or the things that help or hinder implementation of new, what we call emerging programs, like programs that are actively in the throes of implementation. Like I said, we know of almost nothing about this stage. I'm aware of at least one HFIP that was operating. It started, was great, was operational for 7 years, and then failed. Right. And it's like, how many of those out there, how many folks have thought about it or started that process, and then things came undone? And what could we do to make sure that doesn't happen? Can we gather up as much information on the barriers and facilitators of that process so that the next generation, the next wave of HFIPs is much more equipped to succeed in that process? The second aim I'm looking at is to engage those frontline violence intervention strategies with the workers who are there. Like I said, we know virtually nothing, but they are the linchpin of the program, right? If you take that person out, you don't really have much of a program, because they are credible with the people who are violently injured, right? Folks from the community who have a lived experience of violence, that I can't go in and have as much credibility in the hospital trying to extract someone from that violent network, where someone else who's lived that life can. And so trying to understand what they do and how they overcome certain things, and kind of how they engage systems that would be in ways that I would not necessarily think to do so, and kind of gather that information that you could package it up together for the next generation of these workers at new sites, to have that information from the beginning, that they don't have to learn the hard way. They can actually, stand on the shoulders of giants and gather that as we bring more programs online to try and break cycles of firearm violence in these communities. And the third is engaging this long-term sustainability. We don't know much about sustainability, like in the scientific world, in the implementation science world, like in general. It is one of the very neglected components of that. It's expensive, it's hard, it's not sexy, it's kind of comes at the end. It's not like right in the immediate, the starting of your program, but it's critical if you want to adapt or change or adjust as you go long term. And we know very little about that, and we know almost nothing about that in terms of HVIPs and violence intervention programs. And so what, right? So we have a wave of incoming HVIPs that we know about. There's funding coming in for them. There's interest. There's in 5 states. Medicaid is now reimbursing the work of those violence intervention specialists for the first time. And so there's financial and other incentives for emergency departments and hospitals to adopt these programs. And so what? Can we shorten that implementation window from the 2 years that we are aware of to 18 months to 12 months, right? Could you get programs online faster so you could have violence intervention work at hospital institutions in more communities around the country to try and prevent those cycles of violence from going? You basically have people working to de-escalate violence with violently injured patients and to extract them from those very dense networks, right? Like if you can get one person out of that network, you can pull a Jenga block out, right? Where that person is no longer in a network to further that, that violence going through that network, right? You can actually, if you get one person out of there, you actually have a ripple effect when it comes to future firearm violence and violence exposure. You can develop toolkits. We can basically build, some infrastructure around these programs with the information we can gather. We just don't have it at the time. And we can also recalibrate, like, oops, this thing hasn't gone so well. Like, let's have these new programs not have to face that.
Sorry to interrupt you, Lars.
Yep.
Just one more minute, if you could, please.
Oh, perfect. And so for AIM 2, like, we don't know what transfers to what context, right? That the work that's done in Philadelphia, we don't know to what degree it transfers to Phoenix, and the work that's in Boston to Baltimore, right? We have a program in Stockton. We don't have one in San Antonio. Is there, transferability there? And so part of what capturing these strategies from these frontline violence intervention specialists will do is help us figure out what transfers and what contextualizes and what can we take and go, oh, we got to tweak that. That's a really great strategy. It's not going to work exactly here, but we can do this. Or what's something where someone has struggled and it's really outside the box for them, but they find someone who's done it, in Miami. And that might actually work. That gathering these together, we could actually start bringing, folks together with strategies to contextualize them to new places where we haven't had the ability to do so before. And finally, for so what for AIM 3, is we've just overlooked this. So we don't have a lot to build off of with HVIPs to be like, we can't point to a ton in the implementation science world. So not only is this going to be helpful to HVIPs, this work with HVIPs is actually going to be helpful to the field of implementation science in general. We think about sustainability often when we get there later, when like really the best time to do it is day 2. You kind of launch day 1, you should be thinking about long-term sustainability day 2. That's really hard. And so how can we do that? So where the new programs that come online are basically engaging from a pre-laid foundation, so that the work, you're not trapped in bureaucracy and struggling through things, that you can generate so much energy and pour that into the actual de-escalation of violence and trying to extract folks from being re-exposed and re-injured and re-entering the hospital over and over and over again. So you can actually break cycles of violence in these communities by really engaging specific people in the network rather than kind of policing territory and hoping something comes of it. I think, and so that basically this is, we can stop that, but you kind of pull one peg out and you can hopefully stop that entire cascade, kind of like pulling out some dominoes, like a domino from that. And there we go. Thank you, Ali, and thank you, folks. Would love to engage some questions. Feel free to email me if we run out of time for that. And I would love to hear you.
Yeah, absolutely. Absolutely. Thank you. There is a question about what community members can do to interrupt the cycle of violence, but I'm gonna move forward with our schedule as planned because we are at time with 15 minutes, and so
okay.
I'm gonna go to the next speaker, and then this is Lars's email. Please email him with any questions that you may have. Thank you for really leading this really important work, Lars. Our second speaker is Dr. Julie Kafka. Dr. Julie Kafka is a postdoctoral scholar with the Firearm Injury and Policy Research Program at the University of Washington, where she studies applied solutions to address firearm-related harms connected to intimate partner violence. She received her master's in public health and her doctoral program from the University of North Carolina Gillings School for Global Public Health, where she was recently awarded, and we are delighted to say this, the UNC Dean's Distinguished Dissertation Award and the Jamie Kimball Scholarship for Courage. Today, she'll be presenting on her research at the intersection of intimate partner violence and the use of firearms. Julie?
Thank you for that introduction, Ali. I hope you all can see my screen. I am presenting on my project focused on risk indicators for intimate partner homicide, and it's such an honor to be here. Thank you so much to Grandmothers Against Gun Violence for supporting this work and for having us. So I'm discussing some difficult topics, including violence, murder, and suicide. Please take care of yourself however you may need to, and know that these resources are available if you or a loved one needs support. So as Ali mentioned, my name is Julie. My research is focused primarily on preventing intimate partner violence. IPV includes any physical violence, sexual abuse, emotional abuse, or stalking by an intimate partner. And so that includes boyfriends, girlfriends, spouses, or exes. My research is also focused on holistic approaches to address perpetration of interpersonal violence and self-harm. I'm going to start by providing some background about my topic, describing the motivation for this work, and concluding with a description of the goals and hopefully the impact of this funded research project. So we already know that when women are murdered in the United States, most of the time they're killed by a current or former intimate partner, usually a male partner. This graph of the victim-offender relationship for murders in the US shows this pretty clearly, with the intimate partners on the left-hand side killing a large portion of female murder victims, shown in blue. Other data sources put this estimate even higher. And these murders don't occur out of the blue. There's often a long history of IPV and related warning signs that provide opportunities to address the situation before it can escalate to a fatality. I want to highlight some important links between firearms, murder, and suicide in the IPV context. About half of women who are killed by their abusive male partner are killed with a firearm. And when a male abuser has access to a firearm, we know that he's 5 times more likely to kill his partner compared to if he did not have access to a firearm. When firearms are used in these murders, it's also more likely to become a murder-suicide. In fact, 46% of abusive men who kill their partner with a firearm will use that same firearm to die by suicide within a 24-hour period. And that's shown in the pie chart in the bottom right. If any other weapon was used, like a fist or a knife, only about 7% of those perpetrators die by suicide by comparison. So that's a pretty stark difference. The reason being that if a perpetrator was remorseful or ashamed or fearful of going to jail after the murder, it's easier to die by suicide when a firearm is on hand compared to if they only had other weapons like fists or a knife, for example. Despite the extent of this problem, only one study in the United States has used a rigorous research design to identify warning signs for these murders. And I want to highlight that the researchers found that male abuser access to firearms and recent suicide threats were among the most important risk indicators for potential murder. Thanks to this study, the results were used to create a victim safety planning tool called the Danger Assessment. And so that's for female IPV victim survivors and service providers so that they can assess the potential dangerousness of an abusive relationship situation so that protective actions can be taken accordingly. Now, while the study was very important and groundbreaking, data were collected over 20 years ago and focused only in urban settings. So we don't really know if these findings are nationally representative or broadly generalizable. Data limitations make research on this topic quite challenging, which is part of the reason there's been a paucity of research in this area. There's no comprehensive registry of murder data available in the US. Rather, data really comes from a patchwork of reporting agencies and/or states. Details about the perpetrator are also often missing. For example, a murder investigation may be unsolved or ongoing by the time that their data is due for reporting. And finally, to rigorously identify warning signs and model risk, researchers need a comparison group of perpetrators of IPV who did not kill their partner. And this can be really tricky and resource intensive to track down. So to summarize, more current representative research is needed to confirm initial findings about possible risk indicators or warning signs for murder. And there's an opportunity to assess the role potentially of novel warning signs that weren't measured or recorded in that original study that I described. There's also an opportunity for us to consider whether and how firearm access by the perpetrator could change the relative role or importance of key warning signs. For example, when an abusive male partner has access to a firearm and there are children in the home, this could change just how urgently an IPV victim might need to consider getting out of that abusive relationship and moving themselves and their kids somewhere safe. So my study, which is funded by Grandmothers Against Gun Violence, will use the most recent information available from the most comprehensive murder data set in the US to examine warning signs for murder perpetration in the IPV context. I want to be really clear that I'm not exploring why murder happens. Rather, I'm looking at how we can better gauge risk. We hypothesize that perpetrator firearm access will be a key warning sign for murder. And as an exploratory aim, we ask how firearm access by the male abuser might change the role or relative importance of key warning signs. My study focuses specifically on male IPV perpetrators who are suicidal, and this is a very large under-researched population. About 26 million female victims of IPV in the US report that their male abuser has ever threatened suicide. And you'll often hear about abusers using suicide threats to coerce or control a partner. For example, an abuser may tell their girlfriend, "If you break up with me, I will kill myself." And so these kind of coercive threats often force a victim to stay in an abusive relationship because they feel responsible for their partner, even though the partner might be abusive and manipulative. So many of these men may be genuinely suicidal and do not end up killing a partner if we hear a case where there's coercive suicide threats. But some of them do, and this study will really help us learn to tell the difference. By focusing on this population, results should still be broadly generalizable. There are common mindsets or motivations for perpetrators of murder and murder-suicide in the IPV context, including revenge, desire to control or punish a partner, possessive jealousy, escape, or a crime of passion. So warning signs may be similar for murder-suicide and murder more broadly in IPV. For this project, I'm using data from the National Violent Death Reporting System for the years 2019 to 2020, which for the first time will include data from all 50 US states, which is very exciting. I'm taking a case control approach where my outcome group is men who kill a partner in a murder-suicide, and the comparison group is men with a history of abusing their partner, but who die by suicide without committing murder. So by using death data for both the cases and controls, the study becomes much more feasible than it would be otherwise. And yet the findings will still be broadly applicable to gauge murder risk, we believe, in real-world IPV situations. My data will be prepared using machine learning and natural language processing to identify appropriate controls. And I'm leading a team of researchers to perform manual review of text in the data source to codify novel warning signs for murder. So what do we expect will be the impact of this work? This study will improve our understanding of male perpetrators of IPV who are suicidal a population that has been largely overlooked, with few interventions to address either interpersonal or self-harm violent behaviors. I also hope that this work will help inform victim safety planning by confirming our early findings, those from the study I mentioned, about warning signs for murder. Finally, this project will also advance our consideration of de-escalation strategies to prevent both murder-suicide and murder-suicide. For our exploratory analysis, this will help us understand how safety planning may need to change or ramp up when we know that a male abuser has access to a firearm, including consideration of how firearm restrictions for IPV perpetrators can be implemented more thoroughly to prevent fatalities. So thanks so much for your time and attention. I'm looking forward to your questions, and you're welcome to contact me via email if that's easier afterwards.
Great. Thank you so much, Dr. Kafka. I don't know if there are any questions. I don't see any questions in the chat box, but if there are any related to the project that was presented, please share, and I'm happy to ask, or you could directly ask. So, Julie, as we are waiting for some questions, if there are any, maybe one question I have is, from your perspective, oh, there we go. We just got a question. So, is there evidence that men who have suicidality can be convinced to lock up or give up their firearms?
That's a great question. So there's been very limited research on this in the IPV context, but we do know broadly in the general population that both men and women who are suicidal absolutely are willing, in many cases, are willing to engage in what's called lethal means safety, or taking firearms and locking them up or storing them outside of the home in times of crises to avoid the risk for suicide. And so we know that those approaches work and that people are interested in having these conversations, especially with loved ones, and healthcare providers are successfully broaching these topics and facilitating some of these conversations. But there really hasn't been research about this when we know there's IPV going on. And I think those conversations will be uniquely difficult in the context of an abusive relationship. And so I think that's an area where we really do need more research work. My own suspicion is that these conversations might be more possible with people who are kind of perpetrating lower levels of violence, but as violence use is more severe, I imagine these men may be less open to the safe firearm storage options. But I do think if we take a really trauma-informed approach and we say, like, we're worried about your safety, this is a time of crisis, if we just give some separation between you and firearms at this time and give you mental health supports, things will be better and safer. I think there's a way to kind of move in and have those kind of safe storage conversations. But yes, the literature is hasn't moved into that yet.
Great, thank you, Julie. And so maybe just in 30 seconds or 1 minute, if you could also tackle the second one, which is, which local agencies do you think will most benefit from your research?
That's a great question. I think what we're seeing is that in cases of murders, or suicide that are preceded by intimate partner violence, oftentimes people are calling the police for help. And that seems to be a really important place where we can at least refer people to supportive wraparound services. Doesn't mean anyone has to get arrested, but this is a common way that people are reaching out for help when they're fearing for their lives or the safety of someone else. And so thinking about how we can use those 911 interactions, not necessarily in a punitive context per se, but to identify who's at risk, to get those dangerousness assessments in there, and to better survey the situation so that supports can be given accordingly and de-escalation can happen. I see that as a really promising avenue.
Wonderful. Thank you very much for that presentation, Julie. And so if there are any questions, again, just as we talked about with Lars's presentation, please contact Dr. Kafka directly. I'm sure there might be some other questions. All right, so moving on to the third presenter today, last certainly but not least, Cami Rankin is a third-year PhD candidate in the Department of Epidemiology at the University of Washington. She's interested in violence and injury epidemiology with a particular focus on using observational data for causal inference, community-engaged research, and policy evaluation. Today, Cami will be discussing her dissertation work that employs a mix and quantitative and qualitative methods to understand the adverse mental health outcomes that result from mass school shootings. Cami?
Thank you so much, Ali. Let me get started. Okay, does that look okay?
Yes.
Okay, wonderful. Hi everyone, my name is Cami, and I'm thrilled to be here to present my project titled School Shootings and Mental Health, Collateral Damage. I'm incredibly grateful to the Grandmothers Against Gun Violence Foundation and all of you that are here today for supporting this work and for giving me the opportunity to present alongside Lars and Julie. Similar to Julie and Lars, before I move into the content of my slides, I wanted to pause and take a moment for folks to step out if needed. What I'll be presenting can be particularly activating for some, so please do what you need to do to take care of yourself. In the presentation today, I'll first do a brief overview and epidemiology of school shootings in the United States. I'll then talk about the motivation for and importance of this work. I'll move into what we currently know about collateral damage after mass school shootings, and then I'll touch on the goals and potential implications of this project. As our positionality and lived experiences shape how we think about research, how we design our studies, and how we interpret data, I wanted to first introduce myself a little bit beyond what Ali has already mentioned. So I'm Cami, I'm a cisgender heterosexual woman. My research interests include epi methods, violence and injury epi, social epi, and health equity. And while my research interests are rooted in my lived experiences, particularly in gun violence, it's important to note that I have not shared all of the experiences of those who are included in this project. So now I'm going to move into a brief overview of school shootings in the US. It's estimated that over 356,000 children have experienced a school shooting since 1999, and their impacts extend far beyond those who are immediately affected. When thinking about and when studying school shootings, it's incredibly important to note, as Ali highlighted at the beginning of this session, that these events are an equity issue and they impact children and communities of color disproportionately. For example, Black students make up roughly 17% of the US student body population, but Black students experience 33% of school shootings. Definitions of school shootings vary widely across databases. They generally include the number of casualties, the time frame, location, and if the perpetrator is included in the casualties. However, the misalignment of definitions makes it very hard to ascertain any information on trends in school shootings in the US. However, certain databases, such as the one that you see here, this is an example from the K-12 school shooting database. This graph shows you any time a firearm was fired, brandished, or a bullet hit school property between 1996 and 2023. And on this graph, you can see that by this definition, it appears that school shootings are on the rise. Additionally, some groups, such as Everytown for Gun Safety, estimate that between 2021 and 2022, we saw 4 times the average number of incidents on school property that we have seen since 2013. When we think of school shootings, we generally think of events such as Uvalde, Sandy Hook, and Parkland, which are the focus of this project. But I wanted to note that these events are less than 1% of school shootings broadly. However, they do account for a disproportionate number of deaths, comprising about 20% of all deaths from school shootings. Given the limited data that we have for mass school shootings, we can leverage existing data from all categories of school shootings to understand the potential targets for prevention and mitigate collateral damage. For example, we know that those discharging guns on school property are often connected to the school, they often access their firearms at home, and they often share their plans ahead of time with others. A number of prevention and mitigation strategies have been proposed over the years and span all levels, including the individual level, school level, community level, and societal level. Some of the most widely accepted proposals include encouraging parents to securely store their firearms at home, for schools to avoid practices that may harm or traumatize students, such as active shooter drills, and to develop evidence-based crises assessments, to contribute to a safe and trusting school and environment and community, and to enact extreme risk laws and child access prevention laws. School shootings are unique, and while they fall within the umbrella of firearm violence broadly, they impact children and families differently than other forms of violence. Despite their growing presence in our communities, the existing literature on how school shootings impact our mental health is scarce. The existing data that you see on this slide highlights that in addition to prevention measures, it's really important that we allocate resources towards those who have already been and who will be exposed to firearm violence at school. Recent studies have shown that among those residing close to a school in which a school shooting occurred, there's been an increased use of antidepressant use, increased stress-related emergency department visits, increased school absenteeism, lower test scores, and lower employment post-graduation. However, information on mass school shootings, granular information within these studies on mental health outcomes, studies at the national level, and studies that look at the impact on families are limited. So there's a number of reasons that these research gaps exist. I've listed a couple here. The first, as I've discussed, is a lack of a standardized definition. Second is the rare and complex and unpredictable nature of these events. Third would be missing and underreported data. Next is a lack of funding for both research and practice. And lastly, are ethical considerations that we have to take into account when studying firearm violence that make us think carefully about the types of study designs that we can and should employ. So to our knowledge, no study has measured the impact of mass school shootings on parents in the US. We know anecdotally through media reports such as those that you see here, that people across the nation feel the impacts of these horrific events, yet without research, we can't advocate for research allocation. The impacts of mass school shootings are profound and affect not only the lives lost, but also the survivors and their communities, and there's much room for growth in the US to support these groups. For example, after the 2011 massacre at a summer camp in Norway, the Norwegian government allocated substantial resources towards survivors, which is predicted to have substantially limited the long-term adverse health outcomes. However, in contrast, in the US, we've found limited evidence that the government has responded to these school shootings or provided any notable changes in mental health resources for students and families. Our hope with the present project is to provide evidence, both quantitatively and qualitatively, that can support advocates working in this space to encourage our politicians and leaders to ensure that schools, families, and communities have access to mental health resources that they need after these tragedies occur. Before I move into my research questions and specific aims, it's important to quickly note the mechanism through which I will be studying the impact of these mass school shootings on society. Our study consists of US adults who likely have no personal connection to the mass school shootings, so we'll be focusing on how these events can cause mental distress through secondary or collective trauma, which is when one experiences trauma witnessing it firsthand or hearing about it from another source. The response to this form of trauma likely varies based on one's relationship to the victims or the survivors, exposure to similar events, and proximity to the event. The three main aims of this dissertation will be to characterize the existing literature on the association between school shootings and mental health in the US, to quantify the impact of mass school shootings on self-reported mental health of US adults, and to develop educational materials for policymakers, school superintendents, and community-based advocacy groups working to reduce the mental health impact of school shootings. In aim 1, the scoping review, the goals are to understand the ways in which school shootings are identified and defined for inclusion in academic research, and understand the heterogeneity and the causal inference methods employed. This will give us a sense of where the existing data lies and the rigor of the methods employed in this body of evidence. In aim 2, the quasi-experiment, we'll be using survey data from the CDC called BRFIS, the Behavioral Risk Factor Surveillance data, to compare mental health outcomes among parents after school shootings. We'll do this through the quasi-experiment, like I mentioned, by measuring mental health before and after the school shooting among parents and non-parents, taking the difference between these values to understand what the impact is above and beyond what we would have otherwise expected among parents. Lastly, in our qualitative aim, we'll conduct focus groups to engage the community and the research design and interpretation of these findings. We're doing this first to understand the lived experiences of those that we're studying and to fill in gaps qualitatively that we don't have access to in the survey data. Lastly, we are going to explore the ways in which this research can impact and support advocacy groups working in this space to reduce the impacts of school shootings here in Washington and in the US broadly. Okay, so thank you all so much for listening to this presentation. Thank you for allowing me to present today alongside Lars and Julie, and thank you to them for their outstanding work. My committee is listed on the right and includes Dr. Ali Rohani Rabar, Alice Ellison, Isaac Grew, and Carol Davis. I'd really love to hear from all of you, so my email is here if you have any follow-up questions. Please feel free to reach out. Thanks.
Thank you so much for this presentation, Cami. One question is, does your study include impacts of non-public school shooting sites as public school attendance is dropping? And the other one, how do you find pre-shooting adults?
Yeah, thank you so much for these questions. So at the moment, the quasi-experimental portion of my study, which is the second aim, is focused on the shooting that occurred at Sandy Hook, Parkland, and Uvalde. But to answer your question about non-public school shooting sites, yes, so in the first aim where we're doing a literature review, we will be looking at any school shooting, regardless of the type of school, public, private. Also, we'll be looking at elementary schools, middle schools, high schools, and universities. So we will be including as much data from as many different types of schools as possible. Let's see, how do you find pre-shooting adults? Okay, so I think maybe this is getting at the type of data that we're using. So it's a really excellent question, and this speaks to one of the major data limitations with studying events such as school shootings or violence broadly. With school shootings, because they're unpredictable, in order to understand how the outcomes after the school shooting compare to that same mental, let's say mental health outcomes before the school shooting, there has to be data that has already been collected before the school shooting among the study population of interest, which is a huge limitation in this type of research. So we'll be using data from the CDC. They have surveys that are collected every single day, which means that we can leverage that data and look at individuals who were interviewed before the shooting and look at individuals interviewed after the shooting and compare differences between those groups. Happy to answer follow-up questions on that. It's a little bit confusing. I don't know.
Cami, there are two or three. First of all, there are a couple of wonderful, thoughtful comments about all three of you that I think you see in the chat box. And so I'm not going to repeat that for the interest of time, but there are really thoughtful, kind messages in the chat box. But maybe just 1 more minute, 2 more minutes, because I want to leave enough time for Cynthia to wrap up the session. At the end, there is a question by Larry about whether there is curriculum-wise or education-wise, do you think there is value in units in high schools about gun violence as a leading cause of death among young people in the United States?
That's an interesting question. I'm not sure that I have the right answer. I think part of my research that I'm really hoping to dive into, which is a part of my qualitative aim, is working alongside school superintendents in Washington and teachers and individuals who work in schools to tell them, this is what we're finding. These are the groups who are potentially most vulnerable to experiencing adverse health effects after these school shootings. How can we leverage this research and this data to support these students potentially before as mitigation for adverse health outcomes? So I think there is definitely potential for including units about this in schools. However, we have to be cautious about how we do it, since we know that events such as active shooter drills can be quite traumatizing to students. So we need to be very considerate and thoughtful about how and why we are including what we decide to include in these units.
Great, thank you so much, Cami. I'm sure there are other questions that if you all have, please contact our 3 scholars and researchers directly, and I'm sure they will be happy to address them. I really appreciate all of you attending here. Before I let Cynthia take over, I would just say that as I mentioned, I started this session by saying this is consequential research. I want to emphasize it again. This is not the type of research that just, as we say, gets dust in the libraries of universities and nobody cares about, or it doesn't change anything, and it just makes people feel smart, but it doesn't actually save lives or change any people's life. This is a type of research that is very, very close to policy and program and practice. And so I'm really, really grateful for the support that Grandmothers Against Gun Violence Foundation continues to provide. Whenever I give different talks and presentations across the country, your name comes up as an example of an organization that is really devoted to this type of work and really has set a really great model for the rest of the nation. So thank you so much for your support and for convening this. Cynthia, I think you would like to maybe take it from here. Some final remarks.
Yes, yes, excuse me. Thank you, Ali. And thank you, presenters. But first of all, I also have to thank our foundation and the donors to our foundation. The donors you should be able to see who have been so important to us as we've worked diligently to be able to support researchers such as the wonderful fine researchers that we saw today. That your work is going to impact our community and other communities in ways before that we may not have seen or understood. So first of all, thank you all for coming today, Dr. Rohani Ababar and Cami and Lars and Julie, that we're looking forward to our fall session, or excuse me, our spring session, because in the spring, we're going to learn the impact and the results of your research. So it's called Stay Tuned, everyone, because we're going to be able to answer more questions and see how the work that they have done, what they proposed today, is going to, is going to make an impact. So look for that in the spring. We will be able to have some more time with these outstanding researchers so that we can show their support and encourage others to work in the field. The other thing I think is important for us to know is that as a foundation, we continue to raise funds to support our researchers and look for opportunities for new investigators to be involved in a field that needs more attention at the local level and more attention in ways that will support policy and program development. And this kind of on-the-ground research is the kind that I think that we're going to find in our communities will help us all make a difference. Because sometimes we feel powerless when we talk about the gun violence. But if we support our research and support our researchers, we're doing our bit to contribute to the greater whole. So next, what we will do in the spring is support our researchers again and listen to the results, but we will also encourage others to be involved in the work that we have done. So thank all of you who contributed, thank all of you who supported, and all of you who carry this mission in your hearts and in your work. We appreciate you all. And thanks also again to our tech people and Jade Thurston, as well as Sarah Dean, who put together the slides that we showed at the beginning for the introduction. It takes us all to do this work. Thanks, everyone. See you in the spring.